folks. Thanks so much for being here. We're gonna get started in about 5 minutes. I think, can we elevate this at all? Oh, with a box.
With a box.
Can we mute it?
Yep.
Good evening. My name is Anne Marie Witchker. I'm the priest here at St. Mark's Church in Valley. We are really, really honored to be hosting tonight. We're honored to welcome the Lieutenant Governor back to our space. And we're always honored to be engaged in the civic fabric of our community. We apologize for all the boxes that you see, but this has been part of our effort to respond to the food crisis, the SNAP benefit crisis in our city. And we've had hundreds of people and volunteers through this space just over the last several days. So we believe in a New York that cares for New Yorkers. And we're grateful to be able to host conversations like this where we talk about the health and safety of our communities. So welcome. You're always welcome.
Thank you so much. Okay, let's get the show on the road here. My name is George Albro. I'm the co-chair of an organization called NIPAN, New York Progressive Action Network. Next year is going to be our 10th anniversary. We came together as a bunch of grassroots organizations in 2016 throughout New York State with one purpose, to put Bernie on the ballot. And we needed to get a lot of signatures, and we got 80,000. All volunteer, not one paid signature. And so what we did was we ran some delegates. We had about 120 delegates go to Philadelphia on behalf of Bernie. And Bernie had a lot of good demands, but he had one key programmatic area. Medicare for all. Remember that? So a little while after that, Congress passed the Affordable Care Act. And Bernie managed to put in the Affordable Care Act a clause that said individual states can themselves initiate and run a single payer system. And that was the basis of the New York Health Act. And that's what we're here to talk about. And so I want to thank my brothers and sisters from New York Communities for Change, for Citizen Action of New York, that great organization, and fellow NIPANers. NIPAN, you could get one of these handsome t-shirts for a reasonable price, or you could get one free if you become a sustainer to NIPAN. What does a sustainer do? Well, you help us. You help us fight for the New York Health Act. And also what you do is you get to vote on our 2026 endorsements, which is coming up real soon. I don't know about you, but I'm still beaming from last week's elections. It was wonderful. We're still celebrating. Today, though, and you know why this New York Health Act is really important now, even more? They shut down the government over healthcare, right? And the subsidies. And unfortunately, a number of Democrats did vote to go back, including John Fetterman, who fell today and had to be rushed to the hospital. We hope he recovers. But he thanked on Twitter all the wonderful medical personnel who helped him. He has health care for life, and his family, that the taxpayers pay for. But because of his vote and because of the subsidies expiring for the Affordable Care Act, it's estimated that there may be 10 to 15 million people not being able to afford their health care anymore. And many of those people are going to have to won't be able to pay. And if they fall, they will not be able to pay their bills, and they'll likely go bankrupt. Number one cause of bankruptcy, medical bills in this country. So we have an answer, though. It's called the New York Health Act. And as NIPAN, we've been fighting for this almost from day one. It is our #1 legislative priority. My co-welcomer. We are going to continue fighting for it until we win it. And today, Maria, you want to introduce yourself?
Yeah. So my name is Maria Ordonez. I'm the political director with the New York Progressive Action Network. I'm excited to be here just in time. I don't know what you said already, but
We haven't introduced anyone yet. So.
okay. Just wanted to say that this is an amazing opportunity to talk about the New York Health Act and healthcare for all. Right now, we're dealing with budget cuts to our healthcare, to Medicaid, to everything that's happening in this country, in this world right now. So to have bold leadership in our government is extremely important. Leadership that wants universal healthcare and that cares about every single one of us. Right now, we're seeing so many things happening with ICE, healthcare, immigration, food, everything that's happening. So I'm excited to be here, and so we can fight together and have this conversation about the future of healthcare. So I'll give it back to George.
So they asked Maria and I to do this together because we're about the same age. Let me just conclude by thanking the Coalition for New York Health and one of our speakers, main hosts here tonight. We're going to introduce in a second. And I want to especially thank the Lieutenant Governor. He has shown the vision and the commitment to better and to protect the people of New York State by supporting this bill. And this is a big, big thing for the bill, for the workers of New York, for the people of New York. And we thank you for taking that step. I will let you introduce and read their introduction.
Okay, perfect. All right. So we're going to start it off with Lieutenant Governor Antonio Delgado. He grew up in Schenectady, New York, the son of General Electric workers who taught him the value of hard work and service. He went from collegiate to Oxford as a Rhodes Scholar, then Harvard Law, and built a career as both a hip-hop artist and an attorney, experiences that shaped his connection to everyday people. He later represented New Yorkers in the 19th Congressional District, becoming known as a talented legislator with 18 bills signed into law, including major COVID relief for local communities. Now, Lieutenant Governor Antonio Delgado has traveled the state listening to New Yorkers and pushing for New York where everyone has a fair shot. He lives in Rhinebeck with his wife, Lacey, his 2 sons, Maxwell and Coltrane, and their dog, Leroy. You're a dog person, yay. And our second amazing panelist would be Melanie Diarigo. She's a native New Yorker, mother of 3, and a former congressional candidate. She spent her career as an allied health professional building preventive health strategies and programs for organizations throughout the United States. Melanie is a leading voice for universal healthcare in national politics and currently serves as executive director for the Campaign for New York Health and has been doing an amazing job. Welcome you all.
Well, thank you, Maria and George.
Thank you.
Thank you so much, everyone, for being here with us tonight. I am just absolutely thrilled that we're able to bring you all this program this evening. So just want to put some ground rules before I ask the Lieutenant Governor, make some noise. That's the kind of energy I'm looking for, I guess. Just some ground rules, right? Something I want to remind you before we get started. We like joy, right? There's joy in organizing, there's joy in movement building, and there's joy in working with state leaders who know how to pass meaningful policy and put people first. So what you may not know about me, Maria told you I was the executive director for the Campaign for New York Health. Yes. But in another life, I was a cheerleader. So I know how to make you make some noise, okay? So when I ask you to make noise, I want some noise. So before I ask Lieutenant Governor Antonio Delgado to just tell us a little bit about himself, I want to make him feel welcome in this room. Can you help me do that? I said, can you help me do that? Make some noise. Come on. That's the kind of warm welcome I was looking for. So Lieutenant Governor, thank you so much for being here. Before we dig into this wonderful discussion tonight, I just want to give you an opportunity to introduce yourself and tell us why we're here tonight.
Well, first of all, Melanie, thank you and the Coalition for New York Health and the advocacy that you've been bringing to bear and the org has been bringing to bear for a very long time. It means a lot to be up here with you, knowing the path you've put out and the work you've done. Naipan, George, Maria, Arthur, it's good to see you. Citizen Action, NYCC, everybody who's been on the front lines, pushing for universal health care, for a single payer system here in New York. I am here because this is a moment for New York to lead. This is a moment that has been long in the making. And we have an opportunity to set an example for the rest of the country, but more importantly, we have an example to look out for ourselves and to look out for those who are hurting and for those who wake up every day worrying about their own health and welfare, their own family's health and welfare, terrified at the prospect of a medical emergency bill, terrified at the idea of going bankrupt just to care for themselves. Not only in the richest country the world has ever known, but one of the richest states with the third largest economy of any state in the country, and the 9th largest economy if we were an independent country in the world. So we're here to answer your question, to call the question, why not? Why haven't we? Why can't we? Now, when we have the resources, we have the people, we have the will. It's just about making sure that we proceed here in a fashion that lifts up all folks. So that's why I'm here. I'm excited to speak about this bill in a way that I think hopefully can mobilize and energize folks. This is an issue that gets to the heart of what's fundamentally wrong with our current mode of governance, where it has been bought and paid for through the interest of profit. And this is a cornerstone issue that gets to the heart of how that happens when we're talking about life and death. People's literal well-being is being commodified. No one is actually paying for healthcare in our system. No one. What you're paying for is insurance. And insurance, by design, is meant to extract and exploit for the benefit of someone who's selling you the insurance. Not to provide care for you, but to make it difficult for you to access that care when you need it the most. Unacceptable. Morally bankrupt. And we can change that here in New York.
And we will. Thank you, Lieutenant Governor. I just want to level set before I dig into my questions. I know we've got some folks in the room tonight who are learning about the New York Health Act for the very first time. So just want to take a moment to tell you about what this bill is. The New York Health Act is New York State's single payer legislation. This is a bill that would not only guarantee comprehensive care, but it would upgrade your care. We're talking medical, dental, vision, hearing, pharmaceuticals, and long-term care. I always say it's a winner-winner. It's a winner of a bill. This is what we are asking for. And so when the Lieutenant Governor talks to this moment and asks why not, he's exactly right. Why not? Why not? So on that, I'm excited because not only do we have the Lieutenant Governor here with us tonight, but what you may not know is this is the very first time in the history of the bill that we have someone in the executive chamber who is really supporting us, and not just supporting us, championing us, which makes some noise. Come on, that's exciting. That is exciting. I am pumped. And so, which leads me right to my first question. Lieutenant Governor, earlier this year, you endorsed the New York Health Act.
Yes.
You didn't do it quietly. You didn't quietly agree or talk to us and say, I support it, but don't tell anybody. I'm a little scared, right? Which is what happens. We know this, right? There's a lot of organizers in the room. And so I wonder if you can start us off tonight by talking a little bit about what went into that decision and what were the components of the New York Health Act that made you decide to come out in such a big and awesome way?
Three components. There's a moral component, an economic component, and a political component. That all, I think, at this very moment have come together and created an opportunity for us to make transformational change. And I do want to point out, this is what I think is the theme for tonight. Not change around the edges, not managing a broken system, not tinkering with something that we know is not working. Transformational change is needed in this moment. A wholesale makeover of a system that is bankrupting folks and leaving folks behind. And this has always been a moral dimension. It's not like, we didn't quite understand, or I didn't quite understand some of the moral dimensions to this problem. On a human level, the notion that we would commodify care in the way that we have is profoundly problematic. For me personally, on philosophical grounds, on moral grounds, it is a problem. But then you start layering on top of that the economics of the situation as well. And I think what has happened, particularly even going back to COVID, and we saw the calamity of COVID and the devastation and what happens when you don't have a wholesale self-sustaining system of care and who disproportionately gets impacted by that. But at the same time, what we see right now in real time, where you have cuts, literally cuts to Medicaid that are going to leave millions of New Yorkers on their own and or skyrocket premiums, upwards of $100 to $1,400, $1,420 a month, monthly premiums that are going to put hospitals, up to 70 hospitals across our state, at risk of closure. The economic calamity that we are about to experience and will continue to experience if we don't invest our resources in our own system of care can be devastating. And then on top of that, there's a political moment here where we do have a system right now in the federal government where we are out of power. By we, I mean the folks who actually care about delivering health care for everybody. We don't have power to make that kind of change. Maybe someday that might happen. But what we do is, here in New York, we have that power. We have the resources and we have the kind of leadership that can make it happen. And we can set the example and do so in a fashion that is exciting and bold and transformational and can pick up off of the energy, which you just saw with the mayor's race. What the appetite is for a new type of voice, a new type of leadership that is more dynamic, that is more committed to boldness. We can build off of that with Zoran, with other activists, with individuals who care about the future of the state and about the affordability crisis that is crippling people. This is the moment to actually step up and get it done. So to me, it's a culmination of a long time coming, efforts made by individuals like yourself and advocacy groups like NIAPAN that have been out on the front lines doing this, meeting the moment that we're in right now to get it done. And I can get into the weeds. I know you have other questions about sort of the savings that are getting produced, no premiums, no deductibles, comprehensive care, dental, vision. I know the questions will be, well, how does it get paid for? We can talk about that, but the savings, the money's already in this. The savings, up to $60 billion baked in with insurance, bureaucracy, marketing, profiting, all of that we could reclaim and invested into a system of care that is comprehensive, that enables folks to actually wake up without the stress of wondering how they're going to care for themselves in the event of an emergency. So we have an opportunity here to do something really remarkable. And I just feel very fortunate to be where I am at this moment in time, to be one of those voices to lift up this issue in a meaningful way, and hopefully to get us over the finish line.
We are certainly glad that you're one of those voices as well. I can't underscore enough how much your support for this bill means, not just to me, but to New Yorkers everywhere. I do want to talk about the political moment that you mentioned, right? We know, right? Most of us in this room know that the healthcare system has been really not working for working people, or really most people, for a very, very long time. Right? When people have to choose between their medicine or going to the doctor, or if they're going to pay their rent, do they get to send their kid to soccer? Do I have money for food? These are the real life questions that many families are asking. And it's been like that for a long time. And now we have these attacks from the federal government.
Yes.
Last July, the reconciliation bill, known as OBA, I will not dignify it by pronouncing its entire name, was passed. And there are some devastating consequences that are going to fall out. The Lieutenant Governor just mentioned a few. Skyrocketing premiums. We're in open enrollment now. We're already seeing 5 to 7% increases in the private market, up to 75% in the marketplace. That's an obscene amount of money. He told you that 70 hospitals are at risk of closure, right? And there's a huge hole in the state budget, right? Because of these federal cuts. So I wonder if you could talk to us a little bit about, well, how do you think the New York Health Act can help, right? Is it in fact the solution to the harm coming from the federal government, and why this political moment is so different than any other moment we've had?
Well, first of all, I just want to reiterate how encouraging it is for me to be in this room with all of you. And I'm looking forward to hearing your stories and what you're experiencing and what your hopes and dreams are in this space and what you've had to endure, because we haven't had what we should have here in New York. The thing that's going on in Washington and with Medicaid and cuts which actually implicate and eat into the essential plan, which affects folks who are working families who need assistance with care. It is literally, and by the way, it's all happening to pay for tax cuts for the wealthy. We can't skip over that part. People are losing health insurance in an already broken system in order to fund tax cuts. It is unbelievable. It literally can drive you mad when you actually sit with it and you ask yourself, why are we doing this? What's the objective? To make folks that already have a lot richer? That's the point. At not just our expense, but at risk of our very lives. It's an act of violence that is utterly unacceptable and intolerable on moral terms. And so when you say what's going on in DC, I think of the political moment, because sometimes, politics, you build persuasion around a political moment. What's going on politically can really be what musters the willpower, what musters the strength and the capacity for folks to say enough is enough. And this to me feels like one of those moments where enough is enough. Come on. And that is why I think the cuts that are going to leave millions of folks off of health insurance, that are going to put 70 hospitals at risk, to drive up premiums, all to give money away to the wealthy. Now is the time to leverage that. And yes, we can sustain it. Now listen, I think there's phases to this. I called initially for a special session. We should have already been back in Albany the moment this happened. A lot of folks say, oh, please, before this bill was passed, call your congressman, tell them don't vote. Call your congressman, tell them don't vote. That's all you heard. And then everybody did it, and then it passed, and then we didn't hear anything else. Like, we asked you all to do something to hope to stop it. We asked you, but then the moment it passed, where was our call to action? We're the ones that were saying how bad it was going to be. We were telling you to stop it, and then it happens, and we said, oh, well, okay, just got to deal with it, I guess. No, we act now. We have a responsibility to call a special session. And I would have had us come back to Albany. I would have raised some revenue on the ultra wealthy and on big corporations to at least begin to plug some of the hole and give some life back to the people to help you understand we give a damn about you. And we're not gonna just linger out there for political gain. Because that's what it fundamentally was about, if we're really being honest. People say to themselves, well, maybe they'll feel the pain and that'll push them back to our side of the aisle. You serious? That's how we think about politics? Let folks suffer so you can win? That's not how you inspire confidence and trust in a system. That's how you demoralize people and turn them against the very idea of democracy in the first place. So, that would have been the first step. But then, with the New York Health Act, yes, it is a self-sustaining system that unlocks value, that is being sucked out of the system by the insurance industry at the people's expense. And I want to be clear, it does require a progressive tax to pay on the front end. But let's be clear about something. 90% of New Yorkers, 90% would be paying less in healthcare while receiving more in benefits. Who would like that deal? So let's be honest about what the implications are when you actually open it up for everybody. You get more, paying less. That's a good thing.
Yeah, I think, this political moment that we're in, as scary as it is, right? And I think many of us are feeling uneasy and frightened. I always say there's opportunity in chaos, right? It does feel our federal government is very chaotic at the moment. But the one thing that has been giving me hope, and if you know me in this room, I've been screaming what I'm about to say from the rooftops for the last year, since last November, in that election that didn't go so well. New York State can be our shield. New York State can be the counterpunch to the federal harm that is coming our way. They can do it with the right leader, with the right leadership. They can do it by passing meaningful legislation. And so when we think about how horrible these healthcare cuts are and how horrible it will be for too many New York families, we know that the New York Health Act will counteract every single one of those harms and give us more and will cost less for us. So I think that's so important for us to walk out of here knowing that. And I'm just really grateful for your support on this bill. So I do want to talk about, one of our questions that we get asked all the time, and I know you do as well, which is, well, how are you going to pay for it, right? I know you talked about it a little bit, but what do you say to those people who have been listening to misinformation, right? And let's be honest, some of those folks are, in the state legislature who have gotten misinformation, and it's been so strong and so repetitive and so constant that they believe it. So what would you say to someone who says, well, yeah, that sounds great, but how can we afford it?
So this is a real problem, and this is the moment that we have to really own. Greed has been normalized. We are now living in a time where we have a trillionaire in our midst. Elon Musk. He became the first trillionaire just recently. A trillionaire. I remember when I was a kid, just doodling in my classroom, daydreaming about things when I should have been probably paying attention. Thinking about money and being a trillionaire. And it felt impossible. Who could be a trillionaire? A trillionaire. It wasn't even something I thought could ever be a reality. So here we are with trillionaires, or at least a trillionaire. And we have now, here in New York, 1 in 5 kids growing up in poverty. Half of those kids growing up in deep poverty. 1 in 4 New Yorkers not able to afford basic necessities. 2 out of 5 households not able to afford basic necessities. That means groceries, transportation, that means childcare, that means healthcare, that means housing. People cannot afford to get by. And on top of that, despite being the 3rd largest economy in the country, we have the largest wealth inequality gap of any state. Among the most billionaires, among the most millionaires. And so there's a way in which New York, to your question and to your point, is missing the mark right now. We have the resources in the capital. We have the means. We can invest in people. We can invest in public goods. We can grow a system of care that accounts for everybody. We have it. What we don't have, at least it seems, is the political will and the courage to take on entrenched economic and political power that doesn't want the system to change because they're able to profit off of it. And so it is incumbent upon us to beat back that narrative. It's the same narrative that says we can't raise taxes on billionaires because they'll move to Palm Beach. Folks have said this. You know who's leaving the state of New York? People who make between $30,000 and $60,000 a year. Those are the folks, that's what the stats tell us. If you're into facts, I still am. Those are the people who are leaving the state, and they're not moving to Palm Beach. They're looking to go anywhere where they can afford a place, afford childcare, afford transportation. That's where they're moving. And so we have a lot of, to your point, a lot of electeds who buy into this idea that we're going to lose a certain type of person of a certain level of means. They're okay. They'll be just fine paying a little bit more. You know, here in New York, we have 19 other states with a top corporate rate higher than ours. New Jersey, one of them. Why? What's the rationale? There's not a good one. Just so you know, there's not a good rationale. We can be leveraging these resources and literally right-sizing a system that has fundamentally left the vast majority of people behind. You want to stop, yes, tax the rich. You want to stop the disbelief and the erosion of our democracy, and you point to Trump and you call him the poison pill? No, the true poison pill is what enabled him to rise. The conditions that gave rise to him. And that was persistent, growing economic inequality. That is what it was. It was folks being left behind, and in some cases left for dead, just for folks to get rich.
I love how you drew the comparison from struggling families to trillionaires, right? I mean, that is what we're facing, right? And the majority of us in New York, we can't afford not to have the New York Health Act, right? The trillionaires who yeah, might pay a little bit more, they can more than afford it. So thank you.
I would hope.
Yeah. If they can't, they may have a bigger problem, right? Yeah. All right, so I want to take a moment and talk about health justice as a tool to fight for our democracy. You know, obviously, the last year has been difficult, to put it mildly, right? Certainly from a federal perspective, but it strikes me that we have leaders, you know, really all over the country, but certainly a federal government that can't seem to legislate its way out of a paper bag at the moment. We have leaders that can fight back, but are choosing not to. So when we think about health justice, when we think about the New York Health Act, what are your thoughts in terms of how we can use this policy to really model how a functioning democracy works for people?
In the preamble of our Constitution, one of the central components of government is to promote the general welfare. That's why we form a system of government in part. to promote the general welfare, to promote public goods, not private ends, not the interest of capital, but to promote public good. Healthcare, like housing, like clean air and clean water, like education, these are all public goods that, when invested in properly, can lift up everybody and give everybody the chance to pursue happiness and to feel economic security and the freedom that people tout and wrap themselves around on both sides of the aisle, sometimes do so hypocritically. We have an opportunity with a cornerstone essential issue like healthcare, which literally is about life and death, to define clearly that it is a basic human right, that it is an essential public good, and that there should be certain spaces within society, due to the sanctity of life, that we should protect from commodification, that we should not allow for profiteering on the health and well-being of our fellow human beings. It is exploitative in nature. It is exploitative. And when you have the wherewithal, when you have the financial capacity to create a system that allows us to get beyond that exploitative dimension, we are morally obligated to do that. And from there, you can build a system beyond the healthcare system that actually brings humanity into our system of government, that sees people as people and not just as voters or tools to be leveraged for political gain, but as extensions of government yourself. And to me, that's what's so powerful about this, the New York Health Act. It gets to the heart of what it means to have truly caring, compassionate, thoughtful, people-centered, not corporate-centered, people-centered government. That is what's so powerful about the New York Health Act. And that is why this is the moment to rally around it, to elevate it, because we have such moral bankruptcy in our midst. I can't remember a time over my lifetime where I have genuinely felt like, my goodness, the bad guys are winning. The bad guys are really winning. That's a scary thought. As a parent of 12-year-old twins, I imagine it's a scary thought for you, if you have kids and your grandkids, that we're living in a world where it feels like the bad guys are getting away with it. That's unsettling. We need more good guys. We need more people to step up and fight.
I like that. We do need more good guys. And we're fortunate to be here with one of the best in the state. So I know we're coming up on time, so we're gonna have to do these last two with relative brevity.
Sorry, I'll try to be shorter.
No, honestly, I think we love it, right? Are we loving this? Yes. It's incredible to hear you talk about this really transformative bill that would just change lives. But I'm curious, this next question. Now, prior to your current role, you spent some time in DC.
I sure did.
You know how it works. And so I'm curious to your insight. You know, we often hear as advocates and organizers for this bill from folks who like to say, oh, I totally believe in the concept of single payer healthcare, but it can only work on a federal level. So what do you say to those people?
Well, for those who don't know, I did work in Congress. I served 2 terms. I was elected in 2018 in the Hudson Valley, in the Catskills area. As noted, I believe there were some of you here that were a part of that effort. I appreciate you. That district, for those who don't know, and this is important to share because I think it speaks to, you're not alone in terms of the desire for change and what people really want to hear, irrespective of rural communities, urban, black, white, brown, doesn't matter. The district that I won twice was 90% white, the 8th most rural congressional seat out of 435 in the country, number 8. a seat that Trump won in 2016 by 7 points, and that a seat no Democrat ever won. And I became the first person of color to represent upstate New York in Congress. So I share to say there's a hunger for transformational change and for more, and it's everywhere. And don't let the narratives about geography and difference tell you otherwise. People want and deserve more on a human level, and healthcare is one of those issues that gets right to the core. And so, yeah, it's hard in Congress at the federal level to get a lot done because you are dealing with a massive body of actors. You're dealing with 435 members of Congress. You got the Senate. You know, you got narrow margins. You know, there's a lot to work through. And that's the beauty of this system that we have in America, where you have states and state sovereignty, and you have the capacity to have these laboratories of democracy at the state level that can begin the work of things that could be potentially more transformational down the road. And this has happened across, generations, where there have been issues where states might take a lead, from voting rights to gay marriage, whatever the case might be. States might take a lead on an issue with the understanding that the rest of the country might follow. That's the beauty of our system. And what better thing for us to rally around here in New York, to plant our flag, to tell the rest of the country, come on, it's okay. We can do it.
The water's great here.
The water's warm. Then on this issue right here, where we have the financial wherewithal, that's the key. We have it. We're New York. We have the ability to do this. We genuinely do. Do not let anybody tell you New York can't. This is the place where anything is possible. This is the land of dreamers. Nothing is impossible in New York because anything is possible in New York. And so we have the ability, we have the history behind us to get this done. We just need to embrace the moment for what it is and run all the way through the tape.
I don't think we could close it out on a better note than that. Are we ready to run through the tape?
Run through the tape.
Let's do that. I just want to thank you so much. Thanks everyone for being here. We are going to, in just a few moments, open it up for a town hall style where you'll get an opportunity to share with the Lieutenant Governor your healthcare story, anything you might want to say regarding this. So just hang tight. We're about to transition. But before we do that, Lieutenant Governor, I really, truly thank you so deeply for coming here tonight, for sharing your words of wisdom with us. And on a personal level, as a mom and a longtime healthcare advocate, what it means to see a leader fighting for what's right because it's right, not always politically convenient, but because it's right, because it will help people, because it will help my family and yours. You're really instilling hope where I think for a while I didn't have any. So I want to thank you so much.
I want to thank Melanie let's give it up, Melanie, for her work in this space, for your commitment, for your passion, for your dedication to this fight. And I'd be remiss if I didn't just make one more point about the power of this bill. As you were talking, I started thinking about the farmers that I used to represent in upstate and the small businesses. And I just want to make clear, this is such a profound thing that could happen. When I talk to those small family-owned farmers upstate who can't figure out how to provide health care for their farmers, and they're gonna have to take their whole farm down. Imagine being able to have a system of care for those farmers where they don't have to worry about the cost overhead. Or if you're a small business owner, you have to be on the hook for providing employer-based healthcare. We could do away with that dynamic. We don't have to put that pressure on small businesses to provide employer-based healthcare. And if you're an employee and you feel like you have to work where you are because you're not sure what kind of healthcare you might get if you leave your place of employment, imagine the level of freedom a person might feel to be able to get up and go without having to worry about losing the quality of care that they have. And if you're a senior and you're worried about your Medicare B premiums, those get covered in the new healthcare system that we can provide here. So there's just so much upside. If there really is, there's a tremendous amount of upside all across the board. And please don't let anybody tell you otherwise. Thank you.
Lieutenant Governor Antonio Delgado, let's hear it.
Thank you.
While Maria's coming, I'll just take this quick opportunity to let you all know there's some merchandise and there's some, I didn't mean to say merchandise, I meant to say literature, but there is merchandise from NIPA. It's in, George is giving me the eye. He's teleporting, or whatever, telling me what to say in my mind. There is some New York Health Act literature. You're welcome to it. There are also some signs. If you want to grab one, you're welcome to that as well.
All right. So, give them another round of applause. I'm feeling fire. I hope you're here too. I just want to say that when Zoran was running for mayor, I felt, as a young New Yorker, as a young Democrat, I felt like we were seeing a different type of politics. For once, we were seeing someone that cared. I feel the same way right now. I feel like we have a chance. We have hope. We have hope for New York State. So now we're going to move on to the public comment section of this program. And this section is designed to provide attendees with an opportunity to share their comments on healthcare in New York. You're encouraged to discuss the current state of healthcare, why we need the New York Health Act, any related topics to universal healthcare, any local topics, as we know healthcare is very local and it's different in every neighborhood. And if you do wish to speak, Lamont has a clipboard, so please let Lamont know and sign up. We want to hear from you. And keep your comments to 2 minutes in length. And speakers will be informed of the remaining time by the timekeeper. And once you're done, let's just keep it efficient, and we'll move on to the next speaker. So let's let the first speaker go ahead.
The people who already signed up, right?
Yes. Come on over. Yeah, we're gonna line up right here. Okay.
I'm taking the privilege of sitting in the front row. Can you hear me? Yes? Sitting here tonight, we had a problem in this community that's reflective of a problem all over the state. 7 blocks to the north of here, there's a hospital that 3 years ago was serving 50,000 people a month in its ER alone. 50,000, that's more than 500,000 people a year. It's now closed, it's shuttered. There was a big effort in this community, led by Mark Hanna, who was hiding in the back row. Mark's with Metro New York Healthcare for All, I got it right? And that Mount Sinai Hospital bought that hospital, said they were going to fix it up. They didn't. They just started closing it down. It took them 10 years, a bunch of lawsuits. We got a lot of injunctions, but they closed it down. They said they were losing $100 million a year. That's why they had to close it. We tried to get that money out of the state. We had people, our local elected officials, everyone was united. They went to the governor. She said, sorry, we don't have $100 million to give you. She has $2.5 billion to send out $400 checks to people, but she didn't have to give. What I understand about the New York Health Act is it's not just going to address people being able to go to the doctor, people being able to go to the hospital, people being able to get the medical care they need, but it's also going to create money for hospitals, because all around this state, one of the things I learned in a big part of that fight was how many hospitals we lose every year in New York as they push people to urgent care, which I have a sense is a really lucrative business. So that's one of the important things we have to talk about in terms of the New York Health Act, is how it can stave the closing of hospitals, which are so important. We have hospitals because they're important. They grew because they're important. And now we're losing them all over the place. Thank you.
Okay, thank you. My name is Michael Lynch. I'm a retired New York City teacher. I'm an RTC delegate for the assembly, for the UFT. And I want to say first and foremost, I love the way you spoke. I love it. And I was smiling throughout, and not because even the worst things you said, but because you're speaking truth. You're speaking truth, and you show that you care about people. And I really respect that so much, and you so seldom hear that. And I feel everything you said from the very beginning, when you said, everything you said, but when you said in the beginning that we don't pay for health insurance, I said to myself, what? And then you said, we don't pay for health care, sorry. We don't pay for health care, we are paying for health insurance. And that, so I wanted to say that. And I also have a question. I think this is for a question too. I'm UFT, and the UFT and other unions, powerful unions, have come out against the New York Health Act. And it's boo. And from what I hear, it's a major reason that it's not making more headway in Albany. And I would like to ask, how would you get them to work with us? If this is an open, question period, yeah. I thought it was. How are you going to work to get them to get on board these powerful unions who have voiced, and a lot, they voiced their opposition, and they're having a horrible influence.
So I don't know. So
I am happy to answer that. I want to respect also that we have a lot of folks, but I will answer the question.
Sure.
I think part of the issue is, the benefit of collective bargaining, right? You have union membership, is you negotiate and you collectively come together to try to get the best healthcare you can. And you do that a lot of times when you know that the alternative is not working. There's power in numbers, right? So you come together and you say, well, hey, if we come together and we negotiate something, at least we could be good, not at the expense of others, but to protect the fact that we're collectively bargaining. And I think there's a recognition on my part that that is a valid reality when you're looking out there and you don't know what the alternative is. And it's incumbent upon leaders to be able to build the confidence in the public and build the confidence amongst the collective to help labor, help unions understand that this is where we are going, that this is something that we all can benefit from, that you too are going to benefit from. And that, I think, is what's been missing, is that when you run into these obstacles, that becomes an excuse not to keep trying. That becomes an excuse to not try to advocate and persuade, as opposed to saying, no, we can keep building, we can make the case, and we can build a coalition of the willing that ultimately helps people overcome their natural tendency to want to be protective of what they have, which is human nature. But that's the power of politics, and that's the power of leadership. And you need leadership to make that happen.
Thank you. And yes, it is clear that what you spoke about, that the New York Health Care Act is good for everyone, yes, including every UFT member.
All right.
Every UFT
Thank you so much. So just to be aware of time, the Lieutenant Governor will respond at the end and just do a recap of all the questions, and our timekeeper is right here. So please raise your hand. There you go. That's her. Please be aware. Thank you.
Good afternoon, Lieutenant Governor. Hi, my name is Cameron. I'm a medical student up at Columbia. I'm a fellow with Physicians for a National Health Program, and I was one of the co-founders of an organization called New York City Against Segregated Healthcare that helps to address racism in the healthcare system. I'm also, a Rhodes Scholar myself, so I wanted to see, most of y'all don't know that's not really a good thing, but I appreciate you for being one of the folks that actually wants to stand up for something better than the status quo, as opposed to just taking advantage of the status quo to enrich yourself. So I appreciate that. My comment on the New York Health Act, as a medical student, I work at some of the student-run clinics I'm up at Columbia, so we actually have a clinic that runs out of a church called St. Mary's Episcopal on 126th Street. We serve, predominantly uninsured and unhoused folks. But one of the things that we were noticing is that we started to see more patients coming in who were actually not folks that were coming off of the street, referred from the community. They were actually being discharged from the hospital with follow-up instructions to come to the clinic as their first contact of referral, so that we were their primary care provider. And no disrespect to my classmates, a lot of them are incredibly passionate people. We do a lot of incredible work out of that clinic, but we should not be the backbone of primary care for New York City, for Harlem, for the folks that are coming out of one of the wealthiest hospitals in the country. And so I think we cannot be that infrastructure, and that's exactly the reason why we need universal health care, why we need the New York Health Act. And I want to thank you again for taking a stand to make sure that this legislation gets passed.
Thank you.
Hi, everyone. Hi, Lieutenant Governor. Thank you for a really energizing conversation. My name is Anu Dra. I'm a primary care doctor at Elmhurst Hospital. I'm also part of Physicians for a National Health Program at New York Metro. I'm part of Doctors Council. And Cameron is someone I look up to, even as a medical student, and has done incredible work. I did write something down because, I know you know this and everyone in the room knows this, but to humanize how important and how urgent this issue is. I met a patient in my clinic 2 weeks ago. He's a father born in Queens, electrician. The company he works for, the employer, the boss couldn't afford to pay his employees health insurance. So he's worked there for 20 years, has a great relationship with him. And between paying for his rent, supporting his young adult children, he couldn't afford health insurance on the marketplace. Then 2 months ago, the time it took him to install 50 outlets, he only was doing 10. He was slowing down. And his boss, with who he's really good friends with, he had just gone to the doctor, noticed his legs were very swollen, and forced him that very day, go to Elmhurst, go to the emergency room, Health Hospital, shout out to Health Hospitals, they'll take care of you. He ended up having end-stage heart failure. And if that wasn't bad enough, the home where he was living, the brownstone, the elderly couple, they sold it to move in with their adult children. So he was out of a house too. And this just goes to show how our system of care is failing, not just for healthcare, but all the public goods that you just mentioned, housing, education. And so thank you so much for your authenticity and really speaking to such an important issue. Thank you so much.
Thank you.
Hi, my name's Earl Kimmick. I'm in the healthcare working group of the New York City DSA chapter. Thank you very much, Antonio Delgado, our next governor. So you talked about transformation, that we needed bold action. And yes, indeed. And you mentioned the cuts, the federal cuts, Medicaid. So I have a friend, an activist friend of a bunch of us in the room right here, Tijeta. She can't be here. I'm sure she would be all right with me mentioning her son is on dialysis. He requires an expensive kidney medication in the times when he's not on the machine. That Medicaid, those Medicaid cuts will mean that he can no longer get that medication. This is a death sentence for him, okay? He's like 50 years old, so he's a bit younger than me. He's a baby compared to me, but he could live to be my age and longer, but he cannot if these cuts come through. And this is why what you said about a special session, it's crucial, because the New York Health Act, we know it's going to take a second. First we pass, it's a human right, then we need a second. We need a couple of seconds, like a year, to actually implement that. Right, and so that should be happening right now. It's irresponsible, and it's a damn shame that Governor Hochul can't make this happen. That she doesn't understand. Now is the time to give the big golpe, the pushback to DC. You can talk about resistance all you want, but real resistance is to actually make it happen. And I'm so glad to hear you talk like this, bold and transformative. Thank you.
Thank you very much.
Hi, my name is Ramona Thunderworth. I'm a pediatric emergency physician. I've worked 40 years in the South Bronx and in Harlem. And I recently retired and have moved upstate to a little place called Bovina, where we have 600 people and 6,000 cows. And I have just recently joined the Delaware Otsego New York Health Act Hub. I'm now a member of that. And I have been given a letter to read from Lillian DeMoro, who is the coordinator of that group. So this is a letter to you. Hello, Lieutenant Governor Delgado, meeting so many people. I'll doubt you will remember me. I spoke with you at a candidates fundraiser in Delhi, New York on Sunday, July 28th, 2024. I'm dating myself. A little over 15 months ago, when I approached you to speak with you, you told me there was no need to speak with you because you weren't running for anything. My response was that you might not be running for anything now, but I was sure that you would in the future, and if you weren't, you should. I then proceeded to give you the many reasons I thought you should run for something. The first four were lighthearted, tall, handsome, well-spoken, and knew the issues. But the last, and the reason I approached you, was because I believe that you, like myself and many others, believe that everyone should have access to health care. I then told you that the New York Health Act does just that. Everybody in, nobody out. Healthcare is a human right, not as a commodity. And if the day came that you decided to run for anything and you let the public know that you wanted everyone to have health coverage, you would win whatever you ran for. That time has come. If you continue to support and tell the public about the New York Health Act, we will not only work hard for you to win, but all New Yorkers will want you to be their next governor. And you will be the next governor of New York State. Thank you, Lillian DeMoro, Franklin.
Hello, everyone. My name is Dr. Patrick Haley. I'm a pediatrics resident right here in New York City and a member of our union committee of interns and residents, and a member of Physicians for a National Health Program, New York Metro. I'm here to explain why we support the New York Health Act. The problem with becoming a doctor under the current system is it's not the job that you were promised. We don't choose the treatment plan. Physicians aren't the one making the decision. Profiteers are, right? Just on my last inpatient service a month ago, we were treating a child with a really rare liver disease. She needed therapy to treat a progressing liver disease, and despite urging from the best hepatologist in New York City, her insurance company wouldn't budge. We kept her in the hospital for an additional week, trying to get this medication approved, but her parents' private insurance company, which they paid for, refused to budge at all. We had to discharge her with no medication, with the only hope that her liver disease progressed long enough for her insurance to finally cover the necessary medication. I support the New York Health Act because it's my job to treat my patients to the best of my ability, and I fail to live up to that every day under the current system. Private insurance is an impediment to my practice of medicine every day, and as a member of our union, Committee of Interns and Residents, and our organization, Physicians for a National Health Program, we refuse to remain complicit. Thank you so much to Lieutenant Governor Antonio Delgado for supporting the New York Health Act.
Hi, my name is Ray Rogers, and I head up an organization called Corporate Campaign. I have a question for everybody here. How many of you have ever heard of the stock transfer tax?
Yeah.
Have you? Terrific, because we're going to, beautiful, Lieutenant Governor, because I'm hoping that you're going to support this. This is going to help fund the very things we're talking about. You can go to a website, greedvsneed.org, greedvs.need.org. It'll explain this all to you. Real quick, from 1905 to 1981, we had a stock transfer tax of 0.1%. That brought in billions of dollars for the things that we're talking about. Since 1981, it's all been returned or back to the stockbrokers. Since 1981, because of doing that, the state has lost $600 billion in revenues. If we can rescind the stock transfer tax rebate, giving it back to the stockbrokers, We now, as of July, the estimate, and this is in the Daily News, I wrote something, they printed it. It's in the Daily News, what's in the Daily News, another publication. We will bring in $40 to $60 billion every year in extra revenues. $40 to $60 billion every year in extra revenues. And that money is earmarked for several things, a big portion of it, and this wasn't in the bill until I got involved. A big portion is going to go to healthcare and mental health. Okay, I learned from the politicians that mental health is a separate group. We need healthcare and mental health. Okay, so Lieutenant Governor, I expect you're going to be the next governor. We'll work very hard as long as I know that you're going to stand behind this Healthcare Act and you're going to get behind the stock transfer tax and the rebate. Okay, thank you so much.
Hello, my name is Daniel Pecoraro. I'm not a doctor, possibly a chagrin. Just a dude with Crohn's who cares about this legislation. And I appreciate the Lieutenant Governor for seeing the opportunity to be a willing ally for this legislation. The comment that I had is really, from my perspective, the perspective of those in this room, this is a no-brainer. There are two groups that, from my mind, the need to get on side. And so the question that I have, and I look forward to your answer later, is it basically comes down to what should I say? What will you say? Well, what should I say to my father, who's like Mike Lynch, fellow retired teacher, to my uncle, who's retired MTA, when they ask, well, what's in it for me? I got a good plan. I got a good plan that my union bargained for. I'm retired, so I can't do anything else with this. And then from the perspective of folks who work in the healthcare industry, particularly in Western New York, where it's a huge job center. What are you going to say to the folks when you're in Henrietta, when you're in Rochester, and you say, hey, what's in it for me if there's a potential that, hey, I lose my well-being as part of this, lose my job? Because at the end of the day, this is a win for all of us. And the possibility of making it happen hinges on everyone recognizing that is a win for all of us. Thank you.
Hi, everyone. I'm Damian Archibald. I'm a doctor at Elmhurst Hospital in Queens. I'm so grateful to hear this articulate, courageous, moral stand for what seems like a no-brainer to everyday people, to patients, to healthcare workers. And I just want to take everyone back to March 2020. I know you don't want to go back there, but I was one of the people who was called for patients who were failing on their ventilators at Elmhurst Hospital. We had close to 200 patients on ventilators with not fit for purpose ventilators, running out of medications, not enough staff. 80% of patients in my hospital died when they were on a ventilator. This was carnage. This was apocalyptic. And when I was doing CPR on COVID patients and intubating them, I thought this is horrifying, but at least people will finally understand why we need universal health care. I thought it would be a no-brainer, but 5 years later, we are further from that. And I think you're going to have to really consider who is opposing this and be very real about it. I was at a conference 2 months ago with union benefit fund managers, the real estate industry, and the health insurance industry, all patting each other on the back. The largest landowners in Manhattan are NYU, New York Presbyterian, Columbia, Mount Sinai. There are some heavy players who oppose this. So we will offer your support. I'm a Doctors Council delegate. You have organized labor, health workers who are behind you. So thank you for taking a stand.
Good evening. My name is Frank Garcia. I live in the neighborhood. I'm from this neighborhood. I'm a friend of Lieutenant Governor and a big supporter. We're the ones that first brought him here to this church. We want to thank Reverend Ann for allowing us to use this church. She doesn't have to do this. I know politically she's got a lot of heat the first time we brought him here. She continues bringing him back. So that means the community wants to hear from the Lieutenant Governor. My name again is Frank Garcia. I'm chairman of the Hispanic Chamber of Commerce nationally. I'm also live in this district. As someone in this district, we just had a dear friend, Rebecca Herrera, that Lieutenant Governor knows, who used to work for a diario, owns a magazine in this area, just passed away from a heart attack because she cannot afford health insurance. And so to me, this is something, I was at a big event with all the corporates in Miami where the Lieutenant Governor was in Puerto Rico defending our interests in the community. And unfortunately, Rebecca passed away, I found out this week, because of lack of health insurance. I have health insurance, I just found out it's gonna triple. The companies are already out there and the Wall Street people are already sending out notices to health insurance. I believe that the small business needs to be part of this fight. I make a commitment to support this. I didn't know about it thanks to the Lieutenant Governor and his staff invited me to educate me on this issue. And I just want to say now you have another ally and you have our 100,000 members supporting you. Thank you.
大家好，晚上好。我好，即係我好高興。嗰個副組長呢位副組長同我哋講嘅全民保健，我好高興，好高興。我叫做陳麗儀，係響華策會做護理 A 咧，做咗22年，就俾個24小時咧做咗8年，我個身體都推壞咗啦。 即係冇辦法工作㗎啦，而家我呢啲手都壞晒㗎啦。
Got it. Careful, right?
Okay. Thank you, everyone. Thank you, our Deputy Governor Delgado. Thank you so much. And I'm so happy to be here tonight. And my name is Lai Yi Chen. I am the retired CPC home care worker. I work 24-hour shift home care work for more than 8 years. I've become the home care worker more than 22 years. So I'm here tonight. Want to say a few words.
我個身體全部壞晒㗎啦，失眠冇辦法入睡㗎，一晚咧最多係瞓2個鐘頭時間。如果我係食安眠藥咧，要蝕600蚊自己 pay， 咁我冇辦法繼續做人落去㗎啦。
So because for so many years, 24-hour work, my body falling apart. So right now I cannot sleep. I have insomnia. I had to spend a lot of money to buy those special pills to help sleep. Without those pills, I will have a really bad problems.
我好憎恨啦，胡桃州長。
I hate the governor.
佢話你繼續推廣24小時冇停止。
Because she still allowed the 24-hour workday to continue, to still exist. It's really bad.
已經法庭叫勞工局要執法嘅，但係依然還冇執法，還就繼續推廣嘅24小時工作日，推壞我哋嘅我哋護工嘅身體。佢作為州長，佢唔應該咁樣做，侮辱我哋婦女，欺負我哋女人，我哋一定要站起嚟支持副州長。
Okay, there's so many wage that case, especially the 24-hour case, wage that case in the Labor Department. And the governor still allow it unresolved. It's been so many years. It's time to enforce the labor law. And we really need to unite and come together. And also, I really want to say thank you to the Deputy Governor Delgado. Thank you so much.
佢嘅全民保健，我希望我嘅身體好啲，能夠長命啲，攞到政府我哋嘅退休金，長啲時間攞我哋嘅退休金。
I really hope we can pass the New Year Health Act. Everyone has a good health. Thank you.
Dr. Betty Kolod. I'm a primary care physician, and I'm also chair of Physicians for a National Health Program, New York Metro chapter. What I had originally planned to say is that I'm shocked that it seems that our legislators are prepared to wait until maybe 2027 to see what happens with Medicaid cuts, when they know that the New York Health Act is the solution. And the Medicaid cuts are here. My hospital is bracing. They're squeezing me to see more patients and to bill more. And we're already seeing cuts to Medicaid services. My patient Diana recently had her transportation cut. This seems like a small service that wouldn't have a big effect on her life. Diana, she's about my age, about my height, but she's had a very hard life. And she needs her transportation services to get to her addiction services. When she found out that her transportation was cut, it was actually the anniversary of her father's death. She started drinking again, which led to a bleeding ulcer, which landed her in the emergency room. So clearly treating medicine like a business put her life at risk, and it didn't even save money. But then today, I had another experience that I really wanted to share with you. My patient Emily, who's a super chatty and hardworking former city employee with the best New York accent, told me that she found out she has cancer. She was diagnosed by a doctor who was typing the whole time and did not make eye contact with her. So she went for a second opinion. She found a doctor she trusted. And then when she left the office, she found out that that doctor was out of network, and her daughter paid $500 for that first consultation. I had to stop and cry after that visit, leaving my next 7 patients waiting. So we cannot survive like this. Thank you, Lieutenant Governor, for championing the New York Health Act and for fighting for me and my patients.
Hi, everyone. Good evening. My name is Gary Belkin. Lieutenant Governor, you had me at hello. I just want to acknowledge how many folks came up here who are in the New York City Health and Hospital system. I'm a psychiatrist. I was head of psychiatry at Bellevue Hospital. I oversaw mental health across health and hospitals. I was deputy health commissioner, New York City mental health commissioner. One casualty of the insurance industry skimming of 25% of our healthcare dollars is the cost on our public health services. The burden on it, the degree that money sucks money and air out of the room of talking about better outcomes, of public health investments, of community strengthening as sources of health and well-being. So we end up paying twice as much per capita for health with horrible outcomes. So those costs have to be factored in addition to the lack of access and the ridiculousness of the maze that everyone hates. Everyone hates the system except the people underwriting it and profiting from it. This plan is personal to me in a different sense. I was 27 years old. I worked for the state health commissioner at the time, David Axelrod, because I was exploring how do I get involved in health policy. And he tasked me to work with a group of 2 or 3 other staff to write a universal single-payer health system for New York State. Mario Cuomo backed it. The nurses union backed it. Medical societies backed it. We had town halls across New York State. But and I remember the meeting with Richard Gottfried where we presented this proposal. He was just elected the chair of the health committee. We thought it would be hard to get over the goal line. None of us thought in that room that 37 years later, we would still be having this conversation. We got to get this done. It's ridiculous. And my anger at that delay is honestly driven at Democrats who have been complicit in making this idea exotic, that it's on the progressive wing of the party, that there's something weird about this and foreign about this. And we have to pressure all levels of Democratic office holders to get with it. This is not about progressivism or socialism, it's about realism, and we have to get real right away.
Good evening, everybody.
everybody. Hi, Lieutenant Governor. Thank you for coming tonight. So I'm Saunders Ruffin. I'm an emergency manager here with the city. And I just want to comment on sort of the broader sort of landscape we're living in right now. I think the federal shutdown has, for me, certainly illuminated the fragility of our food access system. And I know that your colleague declared a state of emergency recently because of that. In our department, we were scrambling and trying to make sure that folks could eat. Just standing in line, I don't know if folks know, this is food in these boxes here. So shout out to this building for distributing that. The question I'm getting at is, we know that food is a determinant of health. And in New York City, 1 in 4 children are food insecure. They don't know where their next meal is going to come from. So it's shocking to me that it takes a lapse in SNAP payments to call this an emergency. I think when our kids are hungry, that's an emergency. So I think how can we use the momentum of the New York Health Act, clearly driving at guaranteeing a decent standard of living, to push forward things like a right to food? I know that in Albany there are efforts to amend the state constitution with the right to food. So I think these efforts can work together. So that's what I'm curious about. Thank you so much.
Thank you, Lieutenant. My name is Miriam Hernandez. I'm the organizer for Voting Majority. It's very painful when you go and talk with the people, with the community, and the community say, I don't want to go to the hospital. I'm sick, but I don't want to go because what happened now. So this is something, it's not only adults, it's kids. People are afraid to take the kids to the hospital because they cannot get help over there. Sometimes they have to be in the emergency room for hours, and what they're given is Tylenol for the pain. So this is something, and I hear this every single day, every time, because I'm working with the community. So New York Hearing Majority is part of the Health Act. It's part of this insurance for everyone. It's part of that. But we cannot do by themselves. We cannot do one over here, one over there, one over there. We have to get together to win this. We have to do together. We have to stop this because it's food. I can't believe. Sometimes people come over here for a drink. Oh, I go over there, my drink is this. But people are hungry over here. Children are hungry over here. Children have to go to school to try to eat. I don't think that's fair. So what I have to say is now, let's get united. Let's get together and let's win together. Thank you.
Good evening. Thank you, Lieutenant Governor. Good to see you again. My name is Velvet A. Johnson Ross. I am a housing and homeless advocate with Unlock NYC, Housing Justice for All, and also, this is not just a job for me, it's also personal. As someone who has experienced unhouselessness, I also work with those who are in the shelters, and we speak to doctors every year about how they get better help their patients. And many people who are in the shelters, people don't know, they don't get the chance to see doctors like they should. And people don't understand that when you are unhoused, the last thing you're thinking about is going to the doctor because you have to think about the shelter over your head. People don't think about those people who are out there on the streets. People don't think about the women who have vouchers. And for me, there's another intersectional aspect to this. And people say, oh yes, we think about housing and healthcare, but there's also a racial justice aspect for me. Because this year, 300,000 Black women lost their jobs. And do you know what that means? I mean, 300,000 Black women might have lost their healthcare. So it's not just a crisis, it's an emergency for women who look like me. Because that means they might not have their healthcare, they will lose their homes, they will lose any other benefits that they have because this government is all about DEI and everything else, which puts many people who look like me at a disadvantage. And as I'm out in the streets organizing people who are houseless, I'm seeing more and more women who are like myself. I have a degree from Sarah Lawrence, a master's, and a bachelor's from Brooklyn College, but I still face housing insecurity myself. And I'm seeing Black women who are the same way, who work for the federal government, So we need to talk about these particular things. Intersectionality, like Kimberly Crenshaw said, is very important. We have to discuss those things. I know they're very uncomfortable, but we have to make sure that is something that we do talk about. Just like the sister said about people who are undocumented, we get undocumented folks all the time who are homeless, who are staying in the shelters because they're afraid to say anything because they're like, well, I'm undocumented. What am I going to do? I'm not going to get a home. So we need to really have these tough conversations when we're talking about healthcare to make sure that everyone is included. Thank you.
Good evening. Thank you, Lieutenant Governor Delgado. I just wanted to, my name is Tawfiq Islam. I'm a practicing pharmacist in New York, and I work in different community pharmacies, and I am a huge public advocate for the New York City Health and Hospital and the Safety Net Hospital, and I have worked in those hospitals as well. I just want to express my strong support, how important why this New York Health Act is. Every day in the pharmacy, I witness the direct impact that healthcare access and the lack of it has on patient outcomes. From delayed treatments to medications, non-adherence due to cost concerns, these challenges undermine the well-being of our communities and place preventable strain on the healthcare system. Just the other day, I went through so much paperwork and phone calls to the insurance company. They have prior authorizations on medications, and it is so much burdensome as a pharmacist to go around that. And it's just very unfortunate how I can't provide that level of care or that level of access or that medication that is affordable to the underserved population. So thank you, Lieutenant Governor Delgado, for this strong support for the New York Health Act.
Thank you.
Good evening, Lieutenant Governor and others. My name is Mark Hannay. I've been a resident of this community since 1979. When I moved into the neighborhood as a lowly graduate student at NYU, when this neighborhood was not chic. But I'm glad to be here today. I want to share my own story and then talk a little bit about something that I think hasn't been mentioned that the New York Health really also helps address. And I'm really glad that this is happening. To brag just a little bit, about 12 years ago, I was one of 6 or 8 people that met in a conference room at the Cornell Labor School uptown to found the Campaign for New York Health. Because we had a political moment at that time. Our then assembly member, who happened to be the Speaker of the Assembly, had to resign because of a corruption scandal. And he had been blocking consideration of this bill the whole time. And the new speaker who's coming in, Carl Hastie, said, if you guys hold some town halls all around the state and show me that there's public support, we'll take up the bill, which is exactly what happened. And it passed for 4 years in a row in the state assembly. So, but my own story is what the New York Health Act will do for me is to fix all the problems with traditional Medicare. I'm on traditional Medicare because it allows me to see any doctor or hospital that takes Medicare. I refuse to go into the privatized Medicare program. But it costs me now next year, looking at my expenses, probably about almost a quarter of my take-home pay for my out-of-pocket costs. So this program will fix that, because it's an improvement on traditional Medicare. My other issue, I just want to point out that I think that the New York Health does is it helps address the issue of equity in our healthcare system. We just lost our hospital here in this neighborhood.
Yes, we did.
Because a hospital system uptown that has its main facility where there are over 10 beds per 100,000 residents, the highest rate of any county in the country up there, would not support our hospital down here, which they bought and closed in order to protect their profits. And so now we in Lower Manhattan have less than 1 bed per 100,000 people. And we have a lot of people who live over in the public housing projects on the East River, many of whom are people of color. Beth Israel was there at our hospital. And they took it away to consolidate their business in the whitest, most richest part of New York City. So a bill like this, it also rationalizes our healthcare system so that the services are provided where they need it, the funding is there. We don't have this competition for market share between these huge, gigantic hospital systems that are acting just like for-profits, although they're nominally nonprofit corporations. So this issue of health equity, I think, is really important to stress when we talk about the New York Health Act, that it serves everybody the same. They have a saying over in the UK, the Prime Minister gets the same health care as the guy who's digging the ditch. And that's what this kind of program will do. It will make sure that we get the services we need in our community.
I'm going to take a second shot. I didn't introduce myself. My name is Arthur Schwartz. I happen to be the Democratic District Leader here for the last 30 years, which seems implausible. But I'm also the General Counsel of a group called the Center for the Independence of the Disabled, New York. And I want to talk a little bit about disability. I know the next person online is going to say the same thing. But in New York, I just looked this up, my AI. In New York State, there are 3.9 million adults, which is 26.6% of the population who live with disabilities. People who live with disabilities are much more likely to be on Medicaid because your disability affects your ability to make money. Only 488,000 of those people are get Medicare because they're on SSD. That's a big gap. And the impact of the healthcare problems in New York State, whether it's the federal government cutting Medicaid or the lack of services for people with Medicaid, because a lot of people don't want to take it, is going to largely affect, not only affect, but one of the largest groups, if not the largest group of people that are going to be impacted by the lack of insurance, that are impacted by the lack of insurance, are people with disabilities. And we have to stick that in our hat when we talk about the New York Health Act. Thank you very much.
Hi, my name is Mike Schweinsberg, and I've been a disability rights advocate for 25 years now. And so I greatly appreciate my longtime friend, my political mentor, Arthur, bringing this up. But I differ with you, Arthur. 1 in 4 people in this state are disabled. New York City alone, that's over 2 million people. So I don't like our numbers being sold short, because you made the exact right point. People with disabilities are those who stand to benefit the most from this. Now, also, people with disabilities would recommend, Melanie, a few amendments to the bill to be sure that it fully serves our community. And there was a young lady earlier talking about intersectionality. Right. Know that we are the largest minority by far, and we are totally intersectional. We're found in every single segment of society. And in fact, 60% of people with disabilities come from Black and brown communities. So we all have a reason. Somebody said DEI. Look it up. It's DEIA. Nobody wants to talk about the accessibility portion of that. And I think I'm just going to go back to my seat there and have a little conversation with Melanie about those amendments, but before I do that, I want to say how thrilled I am to be in the room with this man, who, you heard how well he gets the New York Health Act, right? I mean, how thoroughly. I can tell you from personal experience, he's the same way with people with disabilities. You get us, and I thank you for that. Okay, that's all.
All right. Thank you so much, Mike. Thank you, Arthur. Thank you, everyone who gave a few comments, who asked questions. Thank you to everyone who made this possible. The Campaign for New York Health, Melanie D'Arrigo, NICAD, Citizen Action, New York Communities for Change, and every single person who made it here. This is not possible without you. Universal healthcare is a movement of people. It says people over profits, and we're gonna make it happen. So I just want to say that NIMA's gonna host a gubernatorial forum early December, so stay tuned. We're gonna get to hear about more policy issues and from Antonio Delgado again. But in the meantime, I'm gonna hand it over to you to finish it off.
Well, let me say, very inspiring to sit in this room and listen to people share your stories and put yourselves out here in a vulnerable way to make the point about the importance of the New York Health Act. As I sat and I listened to folks and processed all the different dimensions of this, it just reinforced the hunger that is out there. It reinforced for me how possibilities of this moment. It made me appreciate more that while this room is just one room, we could fill rooms up like this all across the state. And on some level, it's kind of sad to think that we can, and yet we haven't done what we ought to do. But it's also, in me, sparks the determination to get the damn thing done. Because we can. And I want to say, a few things. I take notes, and I can't speak to everybody's comment and everybody's questions, but a few things there are a few questions that I want to make sure that I speak to. But one of the gentlemen earlier on, though, talked about dialysis and the trade-off that was felt in that moment. And it made me think of a story when I was canvassing many, many years ago. I got to a door and there was a gentleman who answered it, and his grandchild was in the back. I didn't know it was his grandchild, but I heard the baby crying. He says, "Everything okay?" And he said, "Yeah, I'm okay." He says, my daughter and my grandchild are in the back. He said, "I'm on dialysis." And I never saw somebody look so resigned about his or her own fate. He looked at me and he just, with the most blank face, said, "I have to decide if they're gonna have a place to stay and live and be safe, or if I'm gonna die." And he said to me, "I'm gonna die." And I remember sitting there, floored at the sincerity of his statement. He meant it. And that we were living in a country where that kind of choice even had to be made. And so those stories that you tell, they mean more than you might even know. It's deeper than the numbers. There's human impact in human life. So I thank you for sharing. I don't know where he is, I don't see him now, but there was a gentleman who earlier, there you are, you sir, for making that point. Damien, I don't know where Damien is, but Damien, you said something that, the COVID part, and that brought back a lot of trauma. I'm sure for you personally, I can only imagine being on the front lines of that. And yes, you're right, that should have been a moment. That should have been a moment where we got together. But you also spoke about the entrenched heavy players, I think is what you said, the heavy players. Yeah, they are. They are heavy. And I'm not here to sugarcoat that. They are heavy hitters who have a lot of money wrapped up in this system. They do. But history has taught me that the will of the people and the desire of the people, when it is truly organized and mobilized, and when there's leadership that is able to be a vessel for that, it is possible. It's not going to be easy. It's not going to be something that will just roll over. There will be resistance. But history has taught us that the things that we thought were impossible can become possible. Medicare was impossible. Social Security was impossible. Civil rights reform was impossible. There's a lot of things that were impossible that we were able to make possible. And so I'm here to tell you, I am ready to make this possible, to fight. I heard you on the stock transfer tax. Good point. I loved this being about realism, not just progressivism or socialism, but really it's you, sir, about realism. And I think that's a very important way to put it. So many, I think, important points of the inequities across the system that are persistent and disproportionately affect, and this is the intersectionality part. Whether you're Black, brown, woman, disabled community, or even as somebody who served upstate, rural communities with access to care, access to hospitals, there's a divide and conquer narrative that has set back transformational change time and time again. Our immigrant community now is being scapegoated in that regard. This is not new. This is the textbook play. You got to get them all to turn on each other and not understand that they have shared collective pain. And it is incumbent upon us to get past that. It's the same groups over and over again that get thrown into a pit and expected to fight each other when they're the ones being exploited. We're the ones. And it's important that we figure out a way to get beyond that, to see our shared humanity and understand that it is well beyond just the differences that we see, that there's something deeper than us that we should cling to and hold on to. And that is what this moment is about. That is a moral argument. That is not political. It just isn't. Whether it's left, right is irrelevant. It's about right versus wrong. It's about integrity and decency and compassion and empathy and tolerance and mutual understanding. These things have to resonate again. And we have to get through this divide and conquer. So the intersectionality point, I could not agree more with. The last point, and then I'm gonna bring us home. I'm sorry if I didn't get to everybody's point, but somebody did mention earlier, and it's kind of related to the last point about what's in it for me. What's in it for me? I think that question reveals a culture that we got to get beyond. We have to get beyond this idea of what's in it for me. The moment you entertain that question and give that question legitimacy, we've already lost. The key is to figure out how to help people understand it's a different question that's a lot more relevant, that's a lot more pertinent. And that is, who is it, who are we collectively? Who do we want to be collectively? To ourselves, to our children, to our future? What's the standard of care we want to have collectively? What does it mean to have a just society collectively? What does fairness mean collectively? Like, we cannot allow ourselves to get trapped in our individuality. We can't. And that is how this system is designed, unfortunately. It's making us nasal gaze and worry about ourselves far too much. And that does not help the cause for real change. It undermines, and ultimately it undermines you individually because it makes you less than who you could possibly be. And that is allowing your full sense of self, your full sense of humanity to fully shine. You are limiting yourself as a human being. You are limiting your godlike power. You are limiting your capacity to love your fellow human beings when you walk around with that mentality. And so leadership, in my estimation, I don't mean to preach, even though we're in church, but leadership, in my estimation, has to reach into us and pull that out. And this is what I'm going to say in conclusion. And this is why I think this moment is so profound. And this is why the New York Health Act is so important, because it just hits right to the heart of it. What Trump is doing as a leader, if you want to call him that, is bringing out the worst in us. He's bringing it all out. The anger, the hostility, the fear, the anxiety, the selfishness. He's like, come on, get it all out. I want to feed on that, to enrich myself, to empower myself at your expense. That is one mode of very dark, ugly, cold, dehumanizing leadership. It is cruel. It is cruel. It's not left or right. It's cruel. There needs to be another way that isn't packaged in politics, that's packaged in light, that's packaged in love, that's packaged in truth, that's packaged in an unrelenting commitment to our shared humanity. That cannot be inhibited, that can't be afraid of sacrifice, that can't be afraid of losing power. And that's where politics for too many get in the way. That's why Democrats, as I heard earlier, sometimes keep dropping the ball, because they're worried about the politics of the situation. They're worried about where they fit in the equation. They're worried about how long they can stay in their career. They're not prepared to make the sacrifice that is required on moral grounds to achieve a moral end. And the New York Health Act is a moral objective. And it's incumbent upon all of us here in this room to take this message, and I certainly am with you, all across this state, and remind people that this is way bigger than just healthcare, although healthcare itself is the gateway, the entry point. It is about reconnecting with our shared humanity. It is about building a moral edifice to which we can grow together and beat back the moral bankruptcy that is sucking the life out of our democracy. So I want to thank you all for being with me in this fight. I want to thank you all for understanding the depth of this fight. And I hope that tonight you got a sense in me how dedicated and how committed I am to this fight. So thank you so much. I appreciate it.